let's talk about how the current system is set up. Do you think that the same company should be allowed to own an insurance business, a PBM, as well as pharmacies?
Are you expecting to know? But I'll go first, because that hits on our model dead on. Certainly, we would agree. We think it should be. I think the important part we see is there needs to be better integration across the system. And how do you bring these units together? Have we done it perfectly? No. But it gives us an opportunity to do that. And we want to leverage that for better patient experience, better cost management. And I think that's what we ask our clients to hold us to, you being one and others, is like, are we doing a good enough job at managing costs, managing care in an integrated model that does bring those assets together?
I would add, I think conceivably the notion of having all of the points connected, right? Your inpatient, your outpatient, your pharmacy, your medical, that makes sense. We all know holistically that you want to see the whole picture to best manage outcomes. Where the model has gotten tripped up is that the incentives are no longer aligned for the client. And so unfortunately, if you're the client who is all in with all of those services, you're not quite sure what value you're getting in each portion of it. And God forbid if you decide to extricate yourself from, let's use specialty or pharmacy as an example, then suddenly you have financial penalties to do that. And for services that you're no longer buying from an integrated model, you're now paying a penalty for things you're not getting that you're now purchasing outside that collective. And that to me is where the model breaks down a bit, but conceivably the idea of keeping it together, it makes sense on paper. It's just an execution issue.
Well, I think this is a world of rainbows and sunshine you're describing. And, what I see is unfortunately abuse of power. And so one of the things that I point out all the time is something as simple as weaponizing the Affordable Care Act under the accumulator rule. So those of you who are not familiar with it, the accumulator rule under the Affordable Care Act basically says if your medical and pharmacy deductible have to be contributing mutually to achieving your independent or individual out-of-pocket cost. And so what happens is in the free market we should have, my company will compete for pharmacy benefits and will win. And we'll be awarded the business. And then a medical carrier, oftentimes the vertically integrated entity that lost the business because they couldn't provide a competitive price or service, suddenly says, I shall not share data. I'm going to block you. What is this thing? Now, what's fascinating to me is we're a smaller company and we do this with over 600 entities. We do it for free. And we oftentimes have to program to someone else's standard. Now, if you're a software developer, you understand this is maybe a half a day's work with someone who's competent. But you'll hear these tales of woe from the vertically integrated carrier. This will take us 6 months and $1 million. And then they say, I'll do it once, but I'm going to charge you $20,000 per data feed for something that represents average size of a file of maybe 100 kilobytes. It's disgusting, this behavior. And so, I've made my complaints. I have certainly pled my case. And over time, we've slowly knocked off various entities. There are some that shall not be named that still fight us tooth and nail to this day. And why? Because how do they expect to be competitive? Because they can't even compete in a fair market. So what they want to do is continue to put up walls, artificial barriers that has nothing to deliver better care. And so I find this behavior reprehensible. I sit here as a witness to the change, but it's slow going and there's still extraordinarily bad actors out there. In fact, I got a bill from one of the big three the other day saying for the data fee for one of my clients, they were going to just magically double the price. Double the price for something we do for free for the client, and it's in their standard. And I just want everyone to think about this. So the promise of vertical integration in the rainbow and sunshine that people are talking about is great, but let's get back to what we need, which is access to the payer data and no anti-competitive behavior. That's my position.
I would just add, from a consumer standpoint, the system has to be completely gutted and redesigned. And I think we heard in the earlier session, they're ultimately the payers of the care, and they're suffering they're lost. The healthcare system today has gotten more complex, more confusing, and not affordable at all. And so when you think about that consumer experience, transparency has to be front and center. And where else do we purchase anything else in healthcare or in any other consumer good products without understanding what it's going to cost, what should I expect, what does it mean when I take that medication, what do I need to do to be adherent, where do I need to seek the best care? And I think that's what's fundamentally missing. And so what we're trying to do at Transparent is very similar to what AJ was describing, sort of bringing that transparency to the consumer, but we're doing it across the board, across the medical and the behavioral and the pharmacy benefit, because you can't just have pharmacy in one end of the equation, and you need the data to actually connect all the elements to deliver this comprehensive care, whether if you're an oncology patient, how do I get oncology care from the screenings to finding the right doctor, to getting the right surgery, to being placed on the right pharmacotherapy, to then getting the support. But I need that trusted guidance, that high quality care, and that transparency throughout the experience. And that's what's fundamentally missing. So when you ask, is the system really working? It's not necessarily today at all. And we got to think about the consumer first. And one member in the audience earlier said, we got to start designing from the center first, consumer first. Everything else is to come around it, and I think we haven't done that today.
Yeah, Shazana, I would also add the predictability that you're talking about isn't just what a patient is looking for, the employer is seeking it too. I mean, they genuinely want to know what they're going to spend, and right now it's a complete black hole full of surprises and an inability to really go at risk and say, okay, here's what we think it's going to cost you, outliers or not, and you're not going to get penalized when that happens.